I'll call to order the Germantown School Board Personnel Committee meeting on October 21st, and it is 5:03. Roll call, Ms. Higginbotham.
Here.
Mr. Pollock.
Here.
Mr. Brown, myself, I am here. We will do agenda and revisions. Do we have a motion?
Motion to approve the agenda.
Second.
I have a first and a second. Any discussion? All in favor say aye.
Aye.
Aye. That carries. I'll look for a motion for approval of the September 2nd, 2025 minutes.
Move to approve the September 2nd, 2025 meeting minutes.
Second.
I have a first and a second. Any discussion regarding the minutes? Hearing none, all in favor, say aye.
Aye.
That carries, and that brings us right to reports and updates, item number 5. Martine, we can start off with item A, teacher resignations.
Yeah, so, well, that's louder than I thought it was going to be. We don't have any teacher resignations, but as always, I'm always going to have that there for us, so it's transparent on what we have going with that. So, no resignations.
Perfect. Item B, teacher contracts.
Yep, so the one teacher contract that we're, give me 1 second. The one teacher contract that we're bringing forth is actually for a long-term sub position, and when we hit over that 60 days, we do a contract versus going through our sub vendor. So we'll be bringing forth Brenda. The nice thing about Brenda is she's a retired teacher who actually taught this math class that she'll be subbing for. So you can't ask for a better situation to have someone who knows the content on a very deep level. So that's the one teacher that we'll be bringing forth.
Absolutely familiar name to Kennedy Middle School, 7th grade math. And then item C, staffing update.
Yep, so once again, going through the staffing update, today we did do an interview for the Spanish position. That was a position that we haven't filled currently. It was that Spanish / we also have that multi-language learning position that we've been covering internally. We interviewed for that Spanish position, so we're hopeful with that. That's the one certified staff position that we had. You will also see in there that we have hired 2 special ed aides as well, so we have 2 of those. You will see a few other addition vacancies for special ed assistants. I do want to make sure that I note that I did speak with every one of them. Most of these are circumstantial in balancing life, work, those type of things. None of them are leaving from the lens of we weren't happy with doing this work. It just was a situation for them and their family that they have to find a better balance in the work that they were choosing. So once again, a few vacancies there. However, out of those 4, we did just get 2 that we are currently onboarding. I just didn't have time to update it on here. So really it's 2 for that position.
Great. Great. Any questions? We will move on to administrator and professional technical employee group comp study.
Yeah, so for this one, there is an attachment in there as well, but over the past 2 years, the Germantown School District has completed a comp study for teachers and then support staff. We're getting to the cycle of now looking at the administrative positions as well as the professional technical positions. Those we can run simultaneously because the grouping size isn't as large. In the attachment, when you look at that just pretty much walks you through what the plan will be as far as how do we go about that study. It gives you a little background of when we did that teacher comp study, which would have occurred back in the fall of 2023. And then that went into place that following year, which would have been last year of 24-25. The support staff was done in the winter of 25, and then that went into place going into this school year, 25-26. So we're just on the cycle of looking at the administrative and professional technical. In that attachment, the ultimate goal is to look at the comparisons, not only with our bench districts, but also have those focus groups as well with those groupings of staff or categories, the administrators, professional technical. Professional technical might look a little different in those focus groups because they're all unique in their roles for the most part. But this will pretty much follow the exact same timeline and hit the exact same steps that we did for the other 2 studies as well. So just one of those things that we're ready to look at.
Great. And we're going to be using the same benchmark
Yep,
districts.
the exact same benchmark districts that we used before, so.
Okay.
Any questions on that one?
No? All right. That is or doesn't require any action at this point. So we'll move on to item 6, unfinished business, which we have none, and move right into new business.
All right, so new business. So tonight this is standard in the sense of bringing forth the insurance benefit renewal as we think about our plan for the 26 calendar year. Tonight, I did ask our consultant from R&R to join us to give us not only just a financial update of how the plan is performing, but then also to give an update on any of the benefit renewal piece and the changes that are occurring.
I just point out to the committee and for the board meeting this evening when it's reported out, you'll see under new business, Dr. Castro has labeled this GSD Financial Series, and the focus tonight is consultation and our insurance and benefit renewal. Moving forward through the Finance Committee, we'll continue with the GSD Financial Series as I've communicated with the board on pertinent topics that we will then itemize into a module for our YouTube channel as well as push out through social media and our website so the community has a better understanding of school finance through a series of, I believe, 7 different guest speakers that will come in that will either assist Dr. Castro, Miss Altendorf, or myself in presentation. So just for the public at home to understand why this might be labeled a little different before Michelle shares great news this evening.
Very good. Thank you.
All right, okay. Well, thanks for having me back in. A couple of years ago, when we first started working together, I came in and had the pleasure to explain kind of how the benefits were working and the district's new endeavor into self-funding. And so now we're going to be looking at how is it working for the district. So I want to give you a little taste of what's going on in healthcare, because I know everybody's out in the community talking with either other school districts or other private employers. So just kind of what's happening in terms of healthcare in the country, and then how that impacts specifically Germantown. So when we talk about healthcare in general, inflation in healthcare outsurpasses all other inflation in the nation. So the green line represents what we see in terms of healthcare spend. So that's your cost of going to the doctor, your prescriptions, as well as your insurance. So it's not just the insurance component. And the blue line is all other goods and services. So we can see this is just kind of going off the charts, and then the bottom graph is just letting us know that this is going to continue well into 2032. So we're dealing with kind of a crisis when we're talking about healthcare spend. The reasons for that, we like to track what's kind of changing, what's going on when it comes to healthcare for these rising prices. And in 2025, we looked at what the reasons were, and we can see that it's catastrophic claims and specialty drugs. There was a little bit of a difference in 25 because it was closer to COVID, and we had, there were more of these, hospital systems merging, and people weren't getting their care right away. When we shift and look at the right side of the screen and look at what's causing these healthcare costs to just kind of, again, inflate at such a high pace, the two categories specifically, catastrophic claims and specialty prescriptions, have grown tremendously. So we all watch TV and we see these commercials with all of the specialty drugs. People are very happy and singing a lot of songs about them, but they also come at a ridiculous price tag because of all this advertising. So catastrophic claims are going to be things related to, really one of the largest is, what's the word? I'm spacing on my word. Congenital, that's it, thank you. Congenital problems with children at birth defects and illnesses, cancers and things like that, transplants. So we have more of these conditions, overall spiking the cost for healthcare. And it's resulting in more million-dollar claimants than ever before. So in 2024, there were almost 30% more million-dollar claimants than before. So I think about when I started in the insurance industry, there might have been one. And now, in my past 2025, I have one client with 4. So it's just that it's going off the charts because we have new care, which is great if it's able to help people survive and live fulfilled lives. Gene therapy, cell therapy, transplants, but it comes with a price tag. So again, we just have more high-cost claimants in general. So when we think about the impacts of that, it turns out that the national index then for trend, which is medical inflation, it's 10% nationally. In Wisconsin, our trend is 10 to 12% increases. And that's just kind of off the top. That's just what they're expecting. They, being insurance companies, are expecting costs to increase. And then if claims are running poorly, we know that we have to add additional percentages for that because of claims not running well. So I'm painting a pretty bleak picture here, but because Germantown took this step several years ago to move to self-funding, this isn't as bleak of a story, because what is in yellow in the yellow box is kind of showing you what you guys have taken control of. We have been able to put an administrator, a TPA, and a network in that has driven a lot of savings to manage those expected claims. There's going to be catastrophic claims, we know that they exist, but what claims can we manage? You have control of that when you're self-funded. We have a lot of control when it comes to managing your stop loss. So who's insuring us on the back end? So you guys have taken the right steps to do that with self-funding. So while I'm telling a lot of other employers and talking to other school districts about trend being at 10 and 12%, that's not what I'm here to tell you about today, because we've been making some really good improvements. So when it comes to what the administrative team and your R&R team have been working on, is making sure that you're able to offer the sustainable benefits that Germantown can offer that will retain the great employees that you have and also help you attract new ones, but also be fiscally responsible as a board and district. We have implemented a number of things that you can see listed on the right-hand side. In 2025, we transitioned to add the Nexus network, and I'll explain what that is in a little while. We've encouraged people to use top-tier providers that have better discounts and higher quality outcomes. And we did that through plan design. Again, I'll give you the example of that in a minute. We modified the GLP-1 access, and that is the injectable medications that people take for weight loss, kind of putting some parameters in there. And we're adding direct contracts. We completed a full-blown RFP for a new pharmacy benefit manager. That's what PBM is. And so we've been doing these things all for the past year and a half to try to ensure that we can have a sustainable health plan, and it's working. So what the Nexus network that we put into place keeps that broad network because it's important for the members of the Germantown district and their families to have access to providers that are part of the broadest network. But there are certain providers that have agreed to deeper discounts. And it turns out that after an analysis, we were able to show that over 80% of the members that use the district's healthcare, they're already using those top-tier providers. They're already using Aurora, Freighter, Medical College, and Children's. So let's put another layer of a network into the plan that we have, and then build a plan design that steers people to try to use those providers even more. So in 2025, when we added this, we took the plan design that the benefits that we had in 2024 and even beefed them up into more enhanced benefits if people could utilize those tier 1 providers. So this benefited your staff because if we know that there's already 80% using those providers, now they can have better co-insurance and kind of be rewarded for using that. But people still have a choice. Nothing was taken away in creating this plan design. And because it has worked for the district, we're able to keep the same plan design and keep it for 2026. So we aren't looking at people having to make any changes. All we want to do is continue to educate people about the benefits of using these tier 1 providers. And we do that through a lot of employee meetings. We have meetings, we have 4 of them a year besides open enrollment, where we're coming in and talking to people about how do you spot the dot, where do you find your best dental providers and things like that. So the district administrative team has invested a lot of time and put forth, having me come in and talk to the staff, and people are responding positively to that. So because of that, keeping the same plan design is the recommendation for 2026. And because when we look at how the plan is performing in the next few slides, you're going to also, like, I'll spill the beans, with no increase in any kind of costs to the district or the members for 2026. So every month, we review the benefits and we review how the plan is performing. So this is probably a graphic that you'll be seeing going forward, part of your financial, what is it? Fair financial series, thank you. But we track how was the plan running last year and how is it running this year? And we track all of the expenses that the district incurs. So your fixed fees for having that TPA, UMR, managing the plan, the stop loss fees for the insurance, what you're paying R&R insurance, and what we're paying then in pharmacy claims and medical claims. And we track this every single month. And we go into detail. So we're managing and looking at what these claims are and looking for those opportunities of what else can we do for our strategies so we can make sure this continues to be sustainable. And to prove that it's working, what we did is just did an analysis of where would the district be if we hadn't moved to self-funding and put in some of these strategies, if we would have remained fully insured, taking these increases based on how your claims have been running, because we didn't always have a great year of claims. In the past, we had some tough years. And in a fully insured program, there would have been some significant increases. We wouldn't be looking at trend increases of 10 and 12%. It would have been more. So the kind of the orangish bar graph or line graph shows what we would anticipate your costs to be per employee per year if you were fully insured versus where we are in a self-funded program. So good decision, it was the right time, but it's important to continue to look at these strategies and keep encouraging, people to be good healthcare consumers.
And I just want to mention here too, it's when we're able to save that money there, we're able to reallocate our dollars to other places, right? So how do we continue to be mindful of the money that we're spending for healthcare, and we're able to there reallocate that, which is huge for our district.
And we do the same thing because we have self-funded dental plan. So we do the same type of analysis where we manage or we evaluate how the dental plan is running each month. And we have a report that we share with the district. So we look at how many people are enrolled and what are we paying for Delta Dental to manage the health plan, but then what are we paying out in claims. And so we track this each and every month. For 4 or 5 years, there have been no changes in the rates for dental plans. But you can see that how things are running right now, the dental plan is running kind of over budget. So the cost for dental care is similar to medical care in that it's increasing because there's just fewer and fewer dentists that are out there. So rates are really going up. A lot of dentists are leaving networks. And just as a general rule of thumb, school districts use dental a little bit more than the average citizen, which is great. We want people to use the insurance. So what we did in 2020, during the 2025 year for planning for 2026, was evaluate the dental plan. Is this the right dental plan? Do we have too low of an annual maximum? Are there pieces that we should be adding to the dental plan? And we know after 4 or 5 years, it's probably time to do an increase. So with the help of working with Delta Dental, it was like we probably have to look at a 5.5% increase to the dental rates, which when the dental rates are only, what were they, $40 on the last screen? I'm sorry, I don't have my glasses on. 40.57, 49.7. Yeah, it's 40.67. A 5% increase isn't significant. But because we know that the plan is running higher, it's because there's an awful lot of claims that aren't going to the plan because it's maybe not as rich as it could be. So in 2025, we know with the plan loss ratio being at 115%, we wanted to suggest the 5.5% increase, and then again evaluate the the benefits. So we looked at something called Checkup Plus. Checkup Plus is where your annual cleanings don't count towards your annual maximum. So right now, if a person in 2025 is going to the dentist and it costs $300 for your cleanings, that's coming off of their $1,000 annual maximum. So they only have $700 left for dental care. So we looked at, should we kind of maybe make a change to that? It would increase the rates, but it would really benefit everyone. We looked at, is it better to maybe just increase that annual maximum? Or do we want to increase or change the co-insurance? So we did an analysis to look at all of these different options. And really what we landed on, the way that the best recommendation for the dental plan would be to add Checkup Plus, because that's going to benefit any member who's on the dental plan getting their cleanings for 2 cleanings a year. It doesn't have to be 6 months apart, but 2 cleanings in a calendar year. Now that will just be something that will go toward the plan, and members will still have $1,000 towards their annual maximum. So if that's all you use your dental plan for, then it doesn't cost, it's not hurting you at all. So the recommendation is to add that Checkup Plus and have the district absorb the increase to the dental plan for the year, because as well as the medical plan ran in 2025 or is running in 2025, we're actually ahead of budget quite a bit when it comes to the medical plan. So having the district absorb the increase on the dental plan is the recommendation. And then these are the rates then that were provided. What you're just seeing is the rates that the staff is paying in 2025 would remain the same for 2026, which I think that hasn't happened in the medical side for quite a while. And then we can see the district's portion for the medical is not also going to increase. There would just be the increase for the dental. I don't know if you had more to say on that piece. So things are going well. We're just here to support and keep it going in that direction.
So questions?
Tom?
Can you go back to slide 10? That's the one that had the 2025, 2026 health plan design at the top, where it showed the HSA and the copay chart. That one. It's probably how I'm reading it, but the prescription line, the bottom of the chart,
Yep.
deductible, then 10, 50, 100, 100. So does that mean if I got to go to Walgreens and get a prescription, I have to get up to my 3,500 single before the plan covers anything?
That's how HSA health plans work. Yep. You reach your entire deductible before any co-pays or co-insurance begins. That's
Okay, is there still how do I want to say this, a discounted cost on the prescription?
Yes, that's a great disclaimer. So there's the manufacturer's cost, then there's the discounted price, and you would pay that discounted manufacturer's price. And with the medical plan and the pharmacy benefit manager that the district has in place, it's through CVS. They integrate with GoodRx, and so if there is a coupon that's available, it automatically integrates to give a person the lowest cost option if it's part of GoodRx.
All right, thank you.
Mm-hmm.
Any other questions? No? So basically, the savings that we derive from the medical side due to the management of the plan, we're able to offset the costs on the dental side. So no increased cost to the participants.
That's correct.
Okay.
If I can just as a note, one of the reasons the district continues to offer 2 plans, an HSA plan and a copay plan, is if there is an individual that has a high cost or concern about prescription prices, then they're able to enroll in a copay plan and they don't have that deductible first concern. So that is one of the reasons that the district hasn't, like many districts have, get rid of a copay. They've maintained having both of those.
Any other questions? Michelle?
Russ?
Sure. I'm just looking at the self-funded versus fully. And then just for your 2026 projection, it's $24,195 per employee. That's per employee. And if we were not you're projecting $33,571. That's just what, under 9,500, it's like 9,300 and change per employee that we're saving to allocate for expenditures elsewhere within the district. This isn't like a fund that money gets trapped and has to be used for something else in the medical field. It can legitimately be used elsewhere in the district for improvements.
Yes.
Yeah, and one metric that I would hope to have us be able to track is having that as one of our HR scoreboard metrics that we're presenting, saying, hey, this is how much it was each year. How do we continue to focus on that?
While keep maintaining
Yeah, I
the
was
same
just-
plan.
Yep.
I was just going to say, yeah, while focusing on maintaining the benefits the employees have.
Correct.
I think that's a huge,
Yep.
to understand, we're not slashing benefits
Nope.
to increase savings.
Yeah.
It's actually the other way around.
Very good. Any other questions? All right. Thank you very much for your presentation.
No, you're good. Thank you, Michelle. Appreciate it.
And we are looking for a recommendation on that to the full board.
I'll make a motion with a positive recommendation to the full board to approve the proposed UMR options for health insurance, Delta Dental, and Delta IMED coverage for the 2026 plan year, to include the enhancement to the Delta Dental coverage and the associated cost increase to be covered by the district, with all costs noted in the Germantown School District 2026 benefit rate sheet that was provided.
Second.
I have a first and a second. Any further conversations?
Just a quick comment.
Russ?
So I just want to note, for the sake of just having it on record, when I started on the board, or was first elected on the board, this is one of the projects that was being undertaken by the district. And I know Mr. Barney had up the ad hoc insurance committee. It was a big undertaking. There was a lot of concerns with staff. Could administration handle this? Right, the switch over, how's it going to be? Are we going to lose benefit? It's really important, I think, to note, the benefits have been enhanced, the district savings have been enhanced. This is a win across the board for the district. It's been really interesting to watch it take place, just from administrative down to the staff level. I know there's some bumps in the road in regards to concerns around it, but I think this has shown, with the work that this administration is doing, to not only enhance the benefit side, but also manage the financial side of this district, is really taking those right steps. It was a leap of faith initially, but we're showing the fruits of this 4 years later to really show what those changes are, and financially what the power that can be harnessed. Because this is money that can now go back into the classrooms, can go back into investing in, more staff, or more educated staff, or support of the staff.
Yep.
All those types of things, along with the students and student service. It really matters. And I think, I'm excited for the series to play out, because I think we're going to see a lot of discussion. I don't think there was a lot of questions there, because frankly, the two of you covered this material so well, that we don't need to ask a lot of questions. It's the work kind of speaks for itself. So I'm excited to see as this goes through, and I know it's kind of going to be a monthly scenario. I think it might bleed over into some of our other committees as well. I'm excited to see that move forward, so thank you for that.
Yep, absolutely.
Any other comments, questions? All right, I have a motion, I have a second. All in favor, say aye.
Aye.
Aye. Any opposed, say nay. Hearing none, that motion carries. Thank you,
All right.
Martine.
Yeah. And then,
And the next one is, we have advisor and destination and DI contracts.
yeah, so tonight I'm also bringing to you guys requesting for the approval to issue the attached co-curricular advisors contracts for the Germantown High School, or for Germantown High School and Kennedy Middle School, and for Destination Imagination. So I have an attachment in there of all the advisors and Destination Imagination. You will see in that attachment that there's also additional information in regards to whether they are teachers in the building, or if they're staff or outside of the building, not a teacher. So once again, just bringing this forth to get these approved.
Very good. Have we all had a chance to go through the list? And okay. Now, that will come forward. We'll present this to the full board, so I'll need a recommendation on that.
A motion with a positive recommendation to the full board to approve the advisor and DI contracts.
Second.
I have a first and a second. Any conversations regarding this? Hearing none, we'll take a vote on it. All in favor, say aye. Aye. Any opposed? Hearing none, that carries. And that brings us to the final motion,
Move to adjourn?
Second.
first and second. Any discussion? All in favor, say aye.
Aye.
Aye. Any opposed? Hearing none, we are adjourned at 5:33 PM. Thank you for attending.